Let's talk about the dreaded dowager's hump. Some call it a buffalo hump, others a widow's hump, or just a neck hump. There are plenty of nicknames, and none of them are pleasant. But what's really frustrating is that this hump doesn't just ruin your look, it ruins your life. It rounds your shoulders, stiffens your neck, and completely robs you of that sense of ease. We're talking about chronic pain, numbness, and persistent puffiness. Basically, it's all stuff we just don't need. Today, we're going to get rid of it for good. We'll start by identifying your specific type of hump and what's causing it in the first place. And along the way, we'll work through some techniques that will finally get rid of that dowager's hump. So what actually is a dowager's hump? It's a localized thickening of soft tissue right at the base of your neck, around the 7th cervical vertebra. And what does it look like? And well, it varies really. I'll break down 3 types so you can see which one you have. First is the edematous type. It looks like a soft, ill-defined bulge. Take a look right here. Fluid retention, or puffiness, dominates, along with general back swelling and, of course, muscle tension. It all comes with an unpleasant feeling of heaviness and, naturally, constant tightness. Second is the localized type, a defined hump. It's a pronounced, well-contoured lump, often firm to the touch. In this case, there's muscle hypertonicity, fibrosis, fatty deposits, and calcium buildup. And then there is the bony type. It's a hard, almost fixed lump, easy to feel and noticeable in any neck position. Essentially, it's a prominent 7th cervical vertebra, which you'll find even in very thin people. It's just how some of our skeletons are built. Getting rid of a bony hump is pretty much impossible, and in this case, the best approach is a universal one, to simply love and accept yourself. But of course, as for the other 2 types, the swollen and the dense varieties, you can and should absolutely work on them. Take a look at the before and after photos. They're a great source of inspiration, and those kinds of results are possible for anyone willing to put in the work. The key, as always, is consistency. In just a month, not even 2, let alone a year, you'll see real, impressive changes. Now, to get you inspired, let's dive into our first technique. This will help release long-standing fluid retention and tension in your upper back. It has a beautiful name, too. The star on the forehead. So, what are we doing here? Join your palms together like this and place them right between your eyebrows. Tilt your head slightly downward and make sure to drop your shoulders. From this starting position, smoothly bring your shoulders forward and then draw your elbows together. Return to the starting position. Now, let's start the movement, focusing on the center of your back, right where you feel the most tightness. Keep doing this for 1 to 2 minutes. Pay attention. You should feel some resistance here. It shouldn't be too easy. Imagine you're squeezing a firm ball between your elbows as you bring them together. Do the same on the way back. Feel that resistance as you spread your elbows apart, and once again, initiate the movement from the space between your shoulder blades. Really focus on that feeling. You'll notice the movement immediately becomes much more powerful. Don't just focus on moving your shoulders. Your entire back needs to be actively engaged. The biggest reward of this exercise will be a noticeable reduction in slouching and thoracic kyphosis. We're releasing tension and reducing fluid retention in the upper back, smoothing out the dowager's hump, and making your posture look graceful and elegant. If you have any questions about this technique, friends, leave them in the comments below. I highly recommend mastering this one, mentally preparing for the second technique, and I'll explain why we need it. Generally, when we talk about a dowager's hump, many people blame genetics, endocrine disorders, spinal conditions, or metabolic issues. And yes, that's for sure. All of that is true, and I don't deny it. But more often than not, the real problem is simply our lifestyle. So, let's ask ourselves, why did your body go to the trouble of building up that hump in the first place? It's not out of spite, but as a form of compensation. Ask yourself, who is constantly reaching their neck towards their phone? Who is always leaning their nose toward the screen? The moment you push your head forward, the load on your neck, specifically on your 7th cervical vertebra, increases, as if you've just strapped a giant kettlebell to your back. To support all that weight, your body reinforces the area around the 7th cervical vertebra. And what does it do? It builds up and thickens the tissue. The goal is clear. We have to realign the neck and stop letting it drift forward. To do that, start checking in with yourself throughout the day. Just place your finger on your chin like a button and gently guide your head back into place. By using a few quick reminders throughout the day, you'll start to become more aware of your head's position. Secondly, if you want to get rid of text neck, I recommend wearing a neck brace for just 15 to 20 minutes a day, with the closure in the front. It's incredibly effective. As soon as your head starts to drop forward, you'll immediately feel the brace, giving you that instant feedback. Think of it as the perfect form of biofeedback to help you retrain your posture. And finally, right now, we're going to do a powerful exercise that will help us conquer the text neck syndrome once and for all. It's called the scoop. I absolutely love it. It's super simple to follow, and it's really easy to do right at your computer. Reach the crown of your head upward while dropping your shoulders down. Now guide your chin forward and down, like this. Then, move back up and into a neutral position and hold it here. Now, use your chin to scoop forward and down, just like a ladle. Move back up and into place and hold it, and then continue. Focus your attention not on the first phase, but specifically on the second. That's the key to lengthening and relaxing the suboccipital area. And in case you're not sure if you're doing it right, you need to use your finger again for extra guidance. Watch this. Press your finger against the center of your chin like a button, and make sure to relax your face while you do it. Press, pull, and release. Move smoothly without any jerking, and hold the position at the very end to get that deep, satisfying stretch in your neck muscles. Can you feel that pleasant tension at the base of your skull? Perfect. Most importantly, stay mindful and release any unnecessary muscle tension. For example, your chest might try to lift and fall along with the movement, but try to prevent that. Place one hand on your chest to monitor it and ensure it stays still. Over time, your movements will become more fluid and graceful, and you'll feel the back of your neck lengthening and releasing tension. The most important thing is to take it slow. Don't rush the process. And one more important thing. Don't be alarmed if you see some skin folds gathering under your chin while doing this. It's completely normal and physiological. That's exactly how it should be. So, tell me, how do you feel right now? It's such a satisfying little technique, isn't it? It's easy to repeat, easy to remember, and simple to incorporate into your daily routine. Do you feel a pleasant warmth or a sense of lightness in your neck? Maybe it feels a bit easier to hold your head up right now? In any case, please share your thoughts and experiences in the comments below. Who knows, your feedback might just be the inspiration someone else needs to start practicing these techniques regularly. We've just completed 2 restorative exercises, and now it's time to move on to deep tissue myofascial massage. With our own hands, we're going to reduce swelling, smooth out the contour of your back, and you'll feel an immediate sense of release. This massage technique is called the cross. Here's what we do. Perform rolling movements across your upper back, working from the top down. Your hands work on both sides of the spine, moving in a strictly vertical direction. Here is what you need to do. Grab the entire layer of tissue and gently shift it backward. Perform this 5 to 10 times. You can do more, but your hands will get tired. If your hands start to ache, just shake them out and keep going. You really need to focus on deep, slow movements. Superficial stroking won't do much, so don't waste your time on it. we need to grab and shift as much tissue as possible on both sides of the spine. The firmer your grip and the deeper you sink your fingers into the tissue, the more effective and deep your work will be. This is how muscle fibers relax. The swelling subsides, the density of the fibrous tissue decreases, the fatty deposit flattens, and signs of calcification fade away. Day by day, your tissues become softer, more supple, and more pliable, just like warm wax or modeling clay. Pretty amazing, right? It also releases the area around the 7th cervical vertebra, so you can truly sculpt an elegant contour for your back with your own hands. That's excellent. Now, let's shake out our hands. Take a breath. Now, we're going to work horizontally, moving from the center outward. We'll repeat this 5 to 10 times, or however long your hands have the energy for. With these movements, it's as if you're gently guiding the tissues of your left and right back muscles away from the spine. Use deep, powerful strokes to smooth out your back contour. Distribute the tissue from the center toward the periphery and feel how, with each repetition, everything within the working area seems to melt, just like warm wax. What does this massage technique actually do? It eliminates old, chronic tension patterns. By releasing this deep-seated tension in your back, you're also having a positive impact on your face. This technique is fantastic for reducing puffiness in the shoulders and upper back, and it also helps to smooth out that hump or tension buildup on the shoulders. Naturally, it also reduces that hump at the base of your neck. It's as if you're finally shedding that heavy, unbearable burden of swelling, fibrosis, and tension from your upper back. Shake out your hands again. Let them rest for a moment. I really hope you enjoyed these techniques and that you'll add them to your daily routine. If you have any questions about the technique, feel free to drop them in the comments. We are here to help. For now, my dear friends, I'll be saying goodbye. I wish you all beauty, health, and wellness.